I will be. Hello. This side, and then he will introduce me. We will go this way.
Follow me and then like switch over.
Hello. Okay. Yeah. Also cannot get. Thank you. Thank you, George. So as we learn about our history, now let me introduce to you our ventilators production line. So let's start. So we have here our pipe-up model, PF30ST. So this pipe-up actually has 5 ventilation modes. And the VGBS is one of the important modes of these 5 modes because it can automatically adjust the inspiratory pressure, can adjust the inspiratory pressure according to the tidal volume. Also, as we can see, the size of the screen is 4.3 inch, and actually the machine also can accurately measure the airflow changes of each of the patient breaths to ensure that the user and the machine work synchronously. And after that, let's go to our high flow machine. So we have this model NEO HIF i7. So this machine can monitor actually flow, temperature, and FiO2. So the flow range goes from 2 liters per minute to 80 liters per minute. And the temperature goes from 29 degrees Celsius to 37 degrees Celsius. And finally, the FiO2 range is from 21% to 100% concentration of oxygen. Then next we have here our VG55 ventilator. So this ventilator actually is non-invasive ventilator. And this machine can provide 2 minutes of emergency oxygen therapy with 100% concentration of oxygen whenever and wherever is needed. And also the machine has extended SpO2 and PR modules. Also, we have one of the feature which is like the high flow therapy, can go up to 6 liters per minute. Next, here we have our model VG70. So we need to stop a little bit on this ventilator because it's actually our hero ventilator because it was used during the COVID-19 pandemic, and it was the most sold ventilator during the COVID-19 time. So this ventilator has 12.1 inch touch screen. Also, it has wide range of ventilation modes. And this ventilator actually it's a turbine ventilator. So that means to actually like use this ventilator, we need only one source of gas, which is oxygen. Then let's talk about one of the most important features that we have on this ventilator, which is our expiration valve. So our expiration valve made of magnesium aluminum alloy, which can be the whole module can be sterilized because it's detachable expiration valve. So we can just unlock the valve and sterilize it. The whole module can be sterilized. Also, the expiration valve is heated inside, which in this way we can avoid any condensation to happen. So next, let's go to our neonatal ventilator. So we have here 2 models of ventilator, VS500S, and we have also another model. We have also another model, VS600S. So these 2 ventilators actually are for neonatal ventilator, and it's for premature, which is like the weight can go as low as 300 grams. Also, both of these 2 ventilators have SpO2 and abdominal sensor. Also, as well, we can mention that the CPAP and PEEP can reach maximum of 23 centimeter He2O. So here we can raise, or you can ask me, well, here there's a difference now, like we mentioned a lot of common features between these two ventilators. So the difference actually is like VS500S, it's meant to non-invasive ventilation, and VS600S is meant for invasive and non-invasive ventilation. So thank you for listening, and this is like our ventilator production line. Now I will hand you again to George to introduce another section of our.
We will continue with our journey. One more reminder: we are currently in place. Okay, so as I said, we do nebulizers and also oxygen concentrators. But today's goal for you is to see our flagship device, which is actually our ventilator VT6000, and in the international market, it comes under the name of the VT8000. I'm sure that you have been quite impressed with all of the features that Omar has shown to you when he was introducing other models, but this is our flagship model. Why? Because this device includes basically all of the features that you have heard in the previous model. What does it have? Well, first of all, this device is a so-called 3-in-1 device. With this device, we include support for all types of the patients, neonates, pediatric, and adult. And the lowest tidal volume in this case we can go is down to the 2 milliliters, thanks to the special proximal flow sensors that you can use for this very special patient type. In the terms of the machine functioning, all you need is actually to provide high pressure oxygen and air, and machine is ready to go. Now maybe let's have a look on the ventilation modes. Ventilation modes that are included in device are quite wide. So basically, among the standard ventilation modes such as BCV, PCV, SIMV, PRVC, we actually again include modes such as BiVent and APRV. But the most new mode that we have here is actually volume support ventilation and also CPRV mode. CPRV mode stands for cardiac pulmonary resuscitation ventilation, and this mode is especially used in the cases when there is need to provide cardiac pulmonary resuscitation. And thanks to the feature of giving like the beep sound, it can guide the person giving the CPR on their compression. Now, let's have a look on some other things that we have in this device. For that one, I would maybe like to talk mostly about our lung protective strategy. In this device, we include something that is called PV loop. And PV loop is one of the special tools that provides you a way to automatically, thanks to the device algorithms and electronics, to detect and measure the suitable levels of the patient heat and tidal volume. And in that case, we can make sure to provide therapy for the patient that will result in the best possible results while avoiding the risk of causing any injury to the patient's lungs or respiratory system. We also include something that we call recruitment maneuver, where we can set the pressure and time and extend use this to expand the alveoli and in that way promote the oxygenation process. In addition to that, weaning is also one of the tricky things when we talk about a patient who needs respiratory support. There's always question how and when to wean the patient, and in order to do that, we include special parameters such as the T01 and the negative inspiratory force in order to be able to detect and measure the possibility of a successful extubation of the patient. In addition to that, we also have the possibility to run this continuous breathing trial, which can also help us in the process of the weaning and extubation. Of course, one of the things that we need to pay attention to is that usage of this device is quite simple. We are very well aware that today's ventilators can be sometimes very complicated, and we must do our best to minimize the user error. In order to do that, everything you can see is quite simple. You can actually modify the display of this screen. In this case, for example, we are displaying 3 types of different waveforms along with the parameters, but of course, all of this can be changed completely. If you want to see only the numbers, 2 presses, and you're like in the screen where all the monitoring parameters are visible for you. 1 press back, you want to see only the loops, here they are. So everything in this device is very simple, and basically you can perform it in 2 touches. For the end, maybe I would mention that in the terms of the nebulization therapy, we provide 2 options. One option is standard pneumatic nebulizer, but we also provide special input for the electronic or mesh type nebulizer that you would connect here. Additionally, we also provide special port for the measurement of the transpulmonary pressure, and in the end, we also have certain port for the management of the endotracheal cuff balloon. This can help us measure and keep the pressure in the cuff, and in this case, we are able to avoid any misplacement of the endotracheal tube, which can have impact on the process of the ventilation for the patient. With this one, I would like to say one more time that this device is very comprehensive, includes everything that you could possibly need, and it's your stable and reliable partner in providing the respiratory support. Now, let us just move to the new product line that we would like to discuss for today. And actually, today we are talking about anesthesia machines as well. As you remember, in 1963, Haier has also started developing anesthesia machine, and during these years, we finally came to this model. This model is called Haier AG70, and this is also the top of our offer. What makes this machine is very special? Well, it's not only about the appearance, which is like very obvious, but also it's about the technology that are included in this device. You will notice that this device does not come with the classical bellows design. It comes with the special built-in system that we call volume exchanger, and this is the system that is having the main role in providing the gas to the patient. This brings many benefits because this kind of the system provides more accuracy and more stability comparing to the standard bellows systems, and can help also reduce the consumption of the oxygen as well as the consumption of the anesthetic agent, which is also one of the important factors. But also thanks to the non-movable part of this so-called volume exchanger system, makes this system very easy to maintain and take care of all the process. Now, when we look on the device itself, again, we have like a very easy interface and adjustable monitor, but the first thing that we could talk about is our electronic flow meter. Electronic flow meter allows you basically to adjust the flow of the gases by yourself, and you have choice to basically set the total flow that you want to set to your patient. You can set amount of the oxygen concentration, and machine will automatically adjust the flows of the corresponding gas. Of course, depending on the patient, maybe some flows will be too high or too low. In order to make sure that we do not overspend or overconsume oxygen and anesthetic agent, we also include this part here, which we call Echo Optimizer, which can give us indication that we are utilizing the flows that are maybe too high, and by reducing the total flow of the gas, we can actually reduce on the consumption of these gases. Of course, electronic vaporizers are like one of the key features nowadays, but of course, we always must have like a backup plan. And in order to do that, we have our system that is basically backup in the case of the unexpected failure of the electronic flow meter. In addition to that, we also provide auxiliary oxygen, where we can connect basically one tube to the nasal cannula, and we can provide conventional oxygen therapy to the patient before and after surgery to basically increase the oxygenation. However, same like when we talk about BT6000, one of the key stuff here is actually like the features that we have in this device. So in this device, we also have like much concerns about the lung protection, and we also include similar tools like we have in the ICU ventilators. So we can say that today anesthesia machines are basically so advanced that they act in a way as like a full featured ICU ventilator. However, in the terms of anesthesia, we have like two very interesting features. They're called automatic induction and automatic resuscitation of the anesthesia. What it means? It means that during the process of induction, a machine will give the list of the steps to the user that user can follow in order to most easily put the patient under anesthesia. Same goes the other way. If you want patient like to resuscitate him and bring him, wake him up from anesthesia, we go to ARPM function, and again we will have list of the steps. Also in this device, we include so-called cardiac pulmonary resuscitation, cardiac bypass mode. This cardiac bypass mode can also help to provide certain kind of the ventilation in order to make sure that patients that are under the bypass have still like some lung protective ventilation provided to their lungs. In the terms of monitoring of the depth anesthesia, we also include one special feature, which is called like measurement of the electroencephalography or EEG. Thanks to this set of the electrodes that will be placed on the patient's forehead. And then we will also have sets of the parameters, such as called QCON, QNOX, PSR, and EMG. And these parameters can help you to monitor the depth of anesthesia, and in the cases if maybe anesthesia is not strong enough, give the guidance for increasing the level of anesthetic agent. Finally, we also have certain parameters such as driving pressure, stress index, and so on, which can also help us to make sure that we are protecting the patient lungs. In addition to all of this, you see that anesthesia system can be also combined with the patient monitor for more monitoring all of the vital signs of the patient. But also on the other side, we have so-called anesthesia information management system. And this system can help you with monitoring all the progress, and medical staff will be able to input all the data and consumption of all the materials in this system. So basically when surgery or case is finished, one report will be generated, and we will have like the idea of the total consumption, both in the terms of the medications and also in the terms of the cost. We are aware that this device is quite good, quite comprehensive, but maybe in some cases, not everyone needs all of this functionality. That's why we also have another model that I would like to show you today. This model is called AG55. And this presents a little bit simplified version of the AG70. What are the main differences? So first difference is that this system now is not utilizing volume reflector technology. We are utilizing the bellows, which still in some cases can be preferred for certain medical staff based on their habits in usage. In addition to that, the flow meter in this device is mechanical flow meter, but with electronic measurement. So we basically combine best things from the electronic and mechanical flow meters. Of course, we will still be able to see the flows on the screen in the form of the virtual flow meter, and still we will have ability to have echo optimizer, which will again indicate to us whether or not we are using proper amount of the flow, and whether or not we can reduce it and save on the consumption of the gases and anesthetic agent. Again, this device also includes the possibility to monitor EEG, and also it comes with a certain lung protective ventilation strategies such as TV tool, recruitment maneuver, cardiac pulmonary bypass mode, and so on. As all our machines, when we talk about vaporizers, we are using our standard mechanical flow vaporizers that are utilizing select attack interface and a possibility of interlocking. All our devices are very compact, have like certain lock system. You can easily move them inside and outside of the OR, and that's why this system can present a very good choice for any operating room, regardless of the size and application scenario. Same as we were mentioning about ICU and OR equipment, anesthesia machines are just like one part of our OR portfolio. Now, Omar will help and introduce our integrated OR and other OR features that we have in our portfolio. Omar.
Thank you, George, for this wonderful explanation. And let's have a look on our integrated OR. So here we have an anesthesia machine. The model is 8800A. So this anesthesia machine has 15-inch touch screen, and also the machine has 2 slots for the vaporizer, electronic flow meter, and we have drawers, pressure gauge for the central gas system, as well as for the cylinder. And if we come to this part, we can see this is our breathing system. So our breathing system is made of magnesium aluminum alloy, which is the whole system can be sterilized. And also the system is heated inside, so we can avoid any condensation. This anesthesia machine now we're having here, we can call it like anesthesia workstation, because as well as you can see, we have patient monitor attached to the anesthesia machine. Then next, we will go to our ceiling pendant. So our ceiling pendant, we have the brand name is CP8300. So this one actually it has electronic drive. This electronic drive is for the tower and it's for the bridge. Also,
Yes.
The ceiling pendant has as well as it has one click button to reset the movement arm for the pendant. So next, let's go and introduce our surgical light.
Which one? Yeah, this one is all.
So here, as you can see, we have our surgical light. The model name is OL9600, and also we can call it like a ceiling light. We can also as well provide like a mobile light. So this surgical light has 114
I don't have
LED,
confidence when talking
and also
camera.
the illumination of this light is 160,000 lux. So one of actually the most, like, let's say, important feature about this surgical light is, as you can see here, one of our colleagues is showing actually what I was going to talk about. So we have this option which is called like light compensation or lightning compensation, intelligent lightning compensation. So what do we mean about this feature? We mean that if actually the surgical light is over the surgeon head, so the exact cell that which is over the surgeon head, it will switch off, and then the whole compensation of the others, the whole lighting compensation will go for the other cells. So even you can have a look, like if I put my hand close to the cell will switch off, and then it will give like it will compensate the lighting. So next we go to our operating table.
Okay,
so we have this brand OB830, and this is our highest operating table. So up here we have cyber carbon heating blanket, and the operating table actually can undertake weight over almost like up to 350 kilograms. And also, if we talk about the height, as you can see, you see like the operating table can go as low as half meter, and to be exact, it can go as low as 495 millimeter, and the highest and it can go high to almost 1.5 meters. So Also, this table, this operating table, can cover actually all types of surgicals or all types of like the surgicals in the OR. So our table consists of 5 parts. We have here the head part, we have here the back part, and in the middle we have the kidney bridge and the seat plate, and last thing we have the leg plate. So this is all about our integrated OR. Now let's move and introduce another section of our booth. So in this part, actually, we have our oxygen production machines. So for this one, we have actually like the small green machine that you can see there. It's portable, actually, oxygen production machine, and it meant to be like actually used for the military use for now. Then in the middle, we can see like this oxygen production machine in the middle. So this one actually we can use it to the in the hospital that doesn't need actually like huge or large amount of oxygen production. And the last one here is actually like the main oxygen production machine that we have. So if we talk about the feature of these machines, we can say also this machine has like membrane separation technique, and also as if we have like if we have a look at the design is very compact, integrated, and a small size comparing to other production like oxygen production machines. And final thing that this machine actually has intelligent mode, which is can be like unattended operation, and also it can be like remotely monitored. So this is all about our oxygen production line machines. Now I will hand you again to my colleague George to introduce another part of our booth.
Okay, so basically we are slowly coming to an end, and basically we have covered many things: ICU, OR, oxygen generation. But there's like one more thing that I would like to show you. Here we have our home care devices. They're basically home care ventilators, and they can basically like be in the two ways. One of them are basically so-called CPAP devices, and another one is called BiPAP devices. You're aware that snoring or sleep apnea is one of the common things, and for this kind of situation, we actually recommend usage of this kind of devices called CPAP devices that will provide continuous positive airway pressure support during the sleeping. BiPAP devices, on the other side, they actually provide the 2 levels of the pressure, and they also can be used for the treatment of the certain respiratory conditions such as chronic obstructive pulmonary disease. And while we're going with this story like to the end, basically I would also like to tell you that we do have certain kind of the mask that you will need like to use with our devices. These masks can come in different sizes and shapes. So for example, here you can see we have certain kind of the nasal pillows. Masks cover both nose and mouth, or oral nasal masks. And also we have the masks that are covering only nose. And what you would need like to know about these masks is that they have like a special design, a special kind of the rubber, so they're very comfortable for the users, and they actually have the minimum amount of the leakage. Basically, with all of this, today we come to the end of our exhibition, to the end of our live streaming today. However, this is just like a one part. Tomorrow we are continuing our session, same time, same place in Arabic, and tomorrow Omar is going to be our host.
So thank you everyone for listening, and we wish you to visit us in our booth 4.1 W27 in CMF in Shanghai. Thank you, everyone, and goodbye.
Thank you. See you.